All Hit Radio.
Welcome to the X Zone, a place where fact is fiction and fiction is reality. Now, here's your host, Rob McConnell.
Come back again. I want you to stay next time. Oh, sometimes the world ain't kind when people get lost like you and me. I just made a friend. Someone you need.
Welcome back to the X Zone. I'm Rob McConnell, and we're coming to you from our broadcast center and studios in Crystal Beach, Ontario, Canada. That is just on the shores of Lake Erie. And from our studio window, I can see the beautiful city of Buffalo, New York, just on the other side of where the Niagara River meets the Lake Erie. And we're here with you 7 days a week, Monday through Friday from 10 p.m. Eastern until 2 a.m. Eastern, and then different hours through different stations and affiliates on Saturday and Sunday. If you'd like to send me an email, xzone at xzoneradiotv.com, on all social media sites, Xzone Radio TV. And if you'd like to find out more about the X Zone Radio Show, just go to xzoneradiotv.com. And you're probably saying, well, what's the TV about? Well, that's because we also have the X Zone TV channel that is distributed around the world by our good friends Simul TV. And to find out more about the X Zone TV channel, visit www.simultv.com. My guest this hour, X Zone Nation, is Dr. CLARKE. He is the president of the Psychophysiologic Disorders Association. He is also clinical assistant professor of gastroenterology, there you go, and assistant director at the Center for Ethics at Oregon Health and Science University. He has more titles than I've ever seen before. And if I keep on telling you about him, my tongue is going to end up wrapped around my ear somewhere. So what we're going to do is we're going to bring the good doctor on. And Dr. CLARKE, thank you so much for joining us, sir. And it's a pleasure having you here.
Great to be with you, Rob. Always happy to talk about my favorite subject.
And tell our listeners what your favorite subject is.
Well, it turns out to be people who come to the doctor because of symptoms just like, any other person would do. Mm-hmm. But it turns out they don't have anything wrong with them that diagnostic tests can find. They don't have an organ disease. They don't have a structural abnormality. But they've got symptoms that are perfectly real. Most of the time, they end up getting frustrated by the healthcare profession, and the healthcare profession gets frustrated with them, frankly. But it turns out that if you know what to look for, you can diagnose what's going on and treat what's going on just as successfully as anybody else. And I teach doctors about this all over North America and Europe. I teach mental health professionals, too, because it turns out that it's all about stress in your life, past or present.
Stress. Do you mean we live in stressful society and we have stressful situations each and every day in our lives?
Yeah, I'm afraid so, Rob. And, as is obvious to you and me and everybody else, the stress business has gotten a lot tougher in the last couple of years with COVID, a pandemic, and all the disruptions that's caused. So this form of illness is, if anything, even more common than it used to be. And it used to be 40% of the people that would go to see a physician.
I know for a fact that a lot of people I know, and in fact myself at times, get totally stressed out. There's no hiding it. COVID was a big stress killer. I fell off of the roof. I ended up in the hospital after shattering my pelvis and my femur.
Oh.
I was under stress while this was happening. My mother, who lives in Montreal, fell, broke her hip. Subsequently, she died in the hospital.
Oh, I'm so sorry.
Yeah, because of COVID, we couldn't even get to see to be with my dad and my brother. So that added stress. And then because of the business we're in, we had government regulations left, right, and center. And now that the pandemic seems to be winding down, and I use the word seems very carefully here, what caused a lot of stress seems to be going away, but the people that were affected are still stressed out.
Yeah, it's been hugely disruptive for people. They've oftentimes lost jobs. They've had to isolate from loved ones. The whole economy's been turned upside down. People have lost their homes because of lost income. The list just goes on and on. And when stress is higher, the body has to deal with it. And one of the ways that it sometimes copes with it is that symptoms can be generated in the brain, that sensations coming from the body that would normally not be even noticed suddenly are creating pain, or they're creating ringing in the ears, any of a whole long host of physical symptoms in the body, gastrointestinal symptoms, nausea, vomiting, constipation, diarrhea, which is how I got into this field in the first place, difficulty swallowing, visual disturbances, headaches, numbness and tingling in the extremities. Back pain is a huge one, neck pain. It was astounding to me
Really?
when I first began in this field, the sheer number of symptoms that people could get, and the severity and the duration. I've had people who have been in the hospital over this, people who've had these symptoms for years or even decades. But I don't want to be, start off your show with nothing but downers here. The good news is that by knowing what to look for, we can identify the causes of this, and we can make a huge difference. I've seen, wonderful outcomes, even in people who've suffered from this for years, just by uncovering the stresses and addressing those issues. People can get much, much better.
How did you get started in this field, sir? You alluded to it in a brief period a few minutes ago, but what got you started full tilt?
Yeah, well, I went through the first 7 years of my formal education and training, which is typical for physicians even today, not knowing anything at all about this. But I encountered a patient who was severely ill. She was referred to us where I was at UCLA by another university because they couldn't make anything out of what was going on with her. We had some specialized testing that we did, but that was normal too. So I was interviewing her at the end, saying, pretty much to say we didn't have anything more to offer, but I asked her one more time about various things, including stress, and to my shock, discovered that she was coping with an enormous stress in her life, actually one that had its source when she was a child, which turns out to be very common in people with stress-related illness, that they went through adversity of one sort or another as a child, and it's still affecting them years or decades later. And at the time, I didn't know if stress as a child could make you physically ill as an adult. She was 37 years old. She'd been ill for 2 years. But there was a psychiatrist at UCLA that I knew was interested in these issues, and I connected the two of them up for an appointment, not thinking anything would come of it. But a few months later, was surprised again to learn that the psychiatrist had cured this woman of her illness completely. The patient was having no symptoms at all anymore, just with counseling sessions once a week for 2 or 3 months. And that just shocked me. There was nothing in my medical education or training that said that such a thing was possible. So I prevailed on the psychiatrist to kind of give me some pointers and give me a framework for how to think about this condition, and thinking, it might come in handy from time to time. Only to find out when I got into practice that I was seeing 5 or 6 patients like this every week, that it was incredibly common, and that the mental health profession wasn't usually that comfortable with people who were physically ill. So I had to take on a lot of responsibility for this group of patients myself. And I was a beginner, at first, but even as a beginner, these ideas were effective enough that I was helping people more than the rest of the healthcare system was helping them. And people got better, and that encouraged me to continue. And now here we are, I think it's 38 years later and 7,000 plus patients.
Wow.
And, I got pretty good at it.
So you're one of the pioneers of looking into stress and helping people better understand themselves, thus alleviating the stress. And I would also imagine that counseling really helps. Is counseling the key?
Counseling is the key, but it has to be the right kind. The prevailing form of counseling out there right now in most places is called cognitive behavioral therapy, but
Right.
that turns out to be more about helping people cope with their symptoms than it is about actually alleviating their symptoms. So there's a number of colleagues of mine scattered around the country who kind of independently arrived at some of these same conclusions. And we had a big conference in 2009 in Ann Arbor where we got to share ideas. And we were just had a tremendous meeting of the minds at that conference. We were finishing each other's sentences.
Right.
We were discussing each other's patients as if we knew them personally. I mean, it was a remarkable meeting. And we formed a nonprofit corporation after that called the Psychophysiologic Disorders Association.
Doctor, I hate to do this. I've got to take my break. Please stand by, sir.
You bet.
Exonation, our guest is Dr. David Clarke, MD, and we're talking about stress this hour. He's also the author of They Can't Find Anything Wrong. Dr. Clarke and I return on the other side of this break. Two websites, ppdassociation.org and endchronicpain.org. I'm Rob McConnell. This is the X Zone. Don't go away.
To go.
Welcome back, everyone. Dr. David Clarke, MD, is our special guest this hour. Two websites, ppdassociation.org and endchronicpain.org. Does stress fall into a mental illness category, or does it fall into a physiological category?
It's a great question. I think of it as a physiologic category because these symptoms are, for one thing, they're 100% real and they're generated by a physiologic process in the brain. This is the point that many people struggle with, is that they feel, let's say, pain in their low back.
Right.
And so they naturally, and so do their doctors, just feel like, well, the pain must be coming from there. But it turns out there's a whole other category of pain that can be generated by the brain. And it's generated by the brain because there are anatomic changes in the nerve circuits in the brain. And those nerve circuits have been altered by stress. And the resulting symptoms can feel every bit as real and every bit as severe as pain that is actually being generated in the location where you feel it. The classic example of this is called phantom limb pain, which happens to people who've had an amputation where they feel pain in the location of their missing limb. It obviously can't be coming from the place where the person is feeling it because that limb is no longer there. It's being generated by the brain. But those symptoms, again, they're perfectly real. They're generated by a physiologic process. But to pick up a little bit where we left off in the last segment, the therapy for this, the psychological treatment for this, goes beyond cognitive behavioral therapy, and it goes into identifying the particular stresses that a person is suffering from, which may be from their childhood, or it may be in their life at the moment. It also involves identifying emotions that people may have, usually negative emotions like anger or fear, that people may not fully recognize they have. Many of my patients have been tremendously angry at people that they also still care about. And so consequently, that anger is kept behind a wall, so to speak, and they're not consciously aware of it. And the therapy process that we use helps to bring that into people's awareness so that they can start talking about it, start doing some writing about it, journaling about it. And the more they can do that, the more they can put negative emotions into words, the less those emotions need to express themselves into their body in the form of symptoms. So it's a whole different kind of psychotherapy that my colleagues and I practice to actually alleviate these symptoms. But the research is showing us that it's much more effective than prevailing forms of treatment like CBT and acceptance and commitment therapy, for example.
How do your patients feel when they go to see you for a physical pain and they end up in therapy for the pain instead of getting either a magic pill or a procedure? So I imagine that what we're looking at here is that a neurological disorder.
Yeah, it can be thought of in that way. When patients come in, they're looking for solutions.
Right.
They want to have alleviation of their symptoms if they can possibly get it. And so when I'm doing an evaluation, I'm considering that they might have an organ disease or a structural abnormality. I'm going to need to do diagnostic tests to make sure those things are not present. But if they're not, then we need to look for other causes. Symptoms don't happen just out of the blue. Symptoms happen for a reason. So we need to start investigating for sources of stress. Was the person under stress as a child? Were they mistreated? Were they made to feel like second-rate human beings? Are they under stress at the moment? What's going on in their life right now? Another issue is many of my patients are the kinds of people that take care of everybody else in their world, but they struggle to put themselves on the list of people they take care of, and that can catch up with you after a while.
You mentioned childhood. Do a lot of people have an aha moment when you start the therapy and you're able to trace back part of this problem of their stress being something that happened years and years and years ago in their childhood?
They certainly do. One of the key questions that I ask people, especially, a lot of people look back, none of us has a parallel life to compare with. So when people look back, they'll say, my childhood had some issues, but it wasn't that bad. I know other people have been through worse than what I went through, and I've kind of left that in the past now. It's really not affecting me anymore. But many times I'll ask people who are insisting on this to imagine a child that they care about who is now growing up exactly as they did. For example, you could imagine yourself as a butterfly on the wall of your childhood home, and you're having to watch a child that you care about try to cope with that environment. And since you're a butterfly on the wall, you can't do anything about it except watch. And how does that make you feel to watch that happening? And a lot of my patients would be just horrified to have an innocent child go through what they did. And that helps them realize and connect with the reality of what they experienced. And then we can go to work on that. We can help them address some of the consequences from that experience, and that in turn leads to improvement in their symptoms.
So what are some of the long-term impacts of adverse childhood experiences, or ACEs?
ACEs is a huge thing in healthcare nowadays. The surveys have found that as many as one adult in 6 has suffered at least 4 of them. So, and that's a huge impact to go through that. And the long-term consequences include the unrecognized negative emotions that I mentioned before.
Right.
It includes low self-esteem. Many people who come from those ACEs environments have a focus on pleasing other people, and they'll do that, even to their own detriment. They're often perfectionists. They're often much more critical of themselves than they ever would be of another person. They have a tendency to choose life partners or romantic partners who are less than supportive of them, let's put it that way, who may even be narcissistic. And so they can become codependent on them because they grew up in environments where they had little choice but to be almost infinitely supportive of the people with the problems in their environment. There's a tendency for them to live on high alert. There's a tendency for them to need a lot of external validation in their lives. On the other hand, more positively, in order to survive those childhood environments, they tend to be very reliable and detail-oriented. They know what it's like to suffer, so they tend to be compassionate towards other people, although sometimes that can be taken to an extreme. So a lot of these personality traits that they carry with them into the adult years can be sources of stress. And if we can find the roots of those personality traits, particularly the low self-esteem, we can help people turn these things around, thereby reducing the stress level, thereby reducing the symptom level.
Are there certain professions that are prone to stress?
Oh, absolutely. Yeah. I mean, I think one of the common denominators is when you're lacking control of your work environment. And that can happen in almost any line of work where the level of the workload, the level of the demands that are placed on you are at a point where you don't have much say about it. You don't have much control about it. You're being asked to do things that you don't have the ability to change or manage. And that covers a lot of different professions. We've seen it particularly in the healthcare profession these days, where we've gotten these waves of COVID patients that have rolled in over and over and over again over the last 18 months. And it's been extremely hard on my colleagues who are on the front lines of the healthcare system. And there's research on this as well, that people who suffer an acute back injury, for example, or acute back pain in the workplace, the x-rays of their backs doesn't predict whether that acute pain is going to go on to be long-lasting chronic pain. What predicts that better is characteristics of their workplace, how much control they have over their jobs, what kind of supervision they're getting. Those are the things that predict whether somebody's back pain is going to transition from short-term to long-term.
All right, doctor, stand by. We've got to take another break, and when we come back, Exonation, more with our very special guest this hour, Dr. David Clarke, MD, and 2 websites for you, ppdassociation.org and endchronicpain.org. We'll be back on the other side of this break. I'm Rob McConnell. This is the X Zone. Don't forget, check out Classic 1220 CFAJ. Their website is classic1220.ca.
Kissed me yesterday. Future isn't just one night. It's written in the moonlight, painted on the stars. We can't change our
Welcome back, everyone. This is the X Zone. I am Rob McConnell. To all our affiliates who are now joining us around the world, welcome. Our guest this hour is Dr. David CLARKE, MD. We're talking about stress. Dr. CLARKE is the author of They Can't Find Anything Wrong, and here's two websites, ppdassociation.org and endchronicpain.org. Doctor, with the amount of stress that kids are under these days, are you seeing an increase in children that are coming to the ER, going to their regular doctor with signs and symptoms of something else, but it's all stress related?
Yeah, my colleagues in pediatrics are definitely seeing that, and my own practice it goes down as low as the early adolescent years. I don't see the younger children, but absolutely the adolescents are, with all of the school disruption that's been going on, the social isolation that they've had to deal with. You take all of the usual teenage stresses that they have to cope with, and then throw all of this COVID-related problems on top of that, and absolutely it creates a higher stress situation. One of the challenges with the adolescent population is that they are still living in the households that sometimes are highly stressful.
Right.
And so you have to understand not only the stresses that the individual teenager is coping with, but also sometimes the dynamics of what's happening in the family with the mom and dad or whoever else is the primary caregiver. So that makes it even more of a challenge diagnostically. But at the same time, many times the parents in those situations mean well. They may be putting a lot of pressure on their kids without intending to. And once they realize the nature of the situation that's being created in that household, they're frequently more than willing to make a few changes to take the pressure off. So those can be very therapeutically rewarding situations to work with as well.
So what can we do to educate the public, even at a very early stage in elementary school, high school, and teach people at the workplace what to do, how to alleviate this stress in order that, the medical community isn't inundated with all these stress-related cases?
Well, I think it starts with just recognition that stress is capable of this, that it is capable of producing, real physical pain, other non-pain physical symptoms. That's the most basic idea that still hasn't become widely known in society. And it's ironic because just in the last month, we've had two major research studies that were published. One of them is called the Boulder Back Pain Study, and they used psychological techniques, a particular one called pain reprocessing therapy, on people who'd had back pain for an average of 10 years. And they just got 2 1-hour sessions a week for 4 weeks, and their pain scores just dropped from an average of 4 or 5 down to 0 or 1.
Wow.
And they stayed at that low level for a full year, even though the therapy was only for a month. And they compared this with 2 control groups, and those 2 control groups, one was an injection into the spine, and those individuals didn't get any improvement at all. So just this whole concept that number one, stress can cause real physical symptoms, and number two, that there's viable, valid treatment available for this. If this was widely known amongst the public and amongst the healthcare profession too, for that matter, it would make a huge difference. We would see these patients go from just wandering the healthcare system with, not getting the help they need, which is unfortunately the current situation, to being diagnosed and treated successfully like anybody else. And I think that recognition will help people to become more aware when there's too much stress in their life, and they can take steps that are individually focused on their own needs.
So why isn't this better well known throughout the medical community as well as through the world? Like, to me, makes perfect sense what you're saying.
Yeah, it absolutely does, and it was a revelation to me, back when I first started in the 1980s, and I've been asking myself since then why this isn't more widely known. And I think the basic reason for it is the way we train healthcare professionals. We train one large group in the problems of the body, the structures and the organs, and we train another large group, the mental health professionals, in the issues of the mind, anxiety, depression, post-traumatic stress, bipolar disorder, what have you. But there isn't enough cross training of the two groups. Anybody who is possessed of a neck between their head and their chest has a connection between their brain and their body, and the influence of the one on the other, and it goes in both directions, can be profound. So we need the healthcare profession to each group that I just mentioned to be aware of the issues in the other group. And once we see that, these patients will go from being highly frustrating for most physicians to being among the most rewarding to care for.
I know that there are certain neuroblocks that are used by neurologists. Is there any such research being done on what can be done to block the stress points so that the person does not feel the stress, and that the stress that they're feeling does not cause any physiological ailments?
Well, I'm not even sure that you would want to do that, because we need to be able to respond to stress.
Right.
It's part of our survival mechanism. It's been part of us as organisms, ever since we had to run from cave bears, eons ago. So we need that fight or flight response to keep us alive.
But is the fight or flight response, is that part of a stress warning system?
Absolutely is, yes.
Okay.
And so we need that as part of being a healthy, functioning organism. But when the stress level gets too high and we don't realize it, that's when we can start getting physical symptoms. And again, some of my patients have had these for years or even decades. But the good news is that we now have techniques that are backed up by the gold standard of research, randomized controlled trials. And there was a second one that was just published in September from Beth Israel Hospital in Boston that showed the same thing as the Boulder back pain study. If you do the right kind of psychotherapy, you can bring the unconscious stresses into conscious awareness. People can use their cognitive skills to work on those things, and consequently they get better. And they found the same wonderful outcomes in Boston that they did in Boulder.
How about hypnosis or meditation? Would this help?
Yes, those are good adjunctive techniques. Mindfulness meditation is a good one. Hypnosis has been tried. It depends. The benefit of hypnosis depends a lot on the skill of the practitioner.
Yes.
But the study in Boston in particular did use mindfulness as a control group, and it wasn't quite as good as the what they call the psychophysiologic stress reduction technique, which involves making people aware of emotions, making people aware of deeper sources of stress like childhood stress. So we're able now, with the techniques that we have, to go above and beyond mindfulness meditation in terms of the outcomes, because the psychophysiologic stress reduction technique was light years ahead in terms of outcomes, in terms of beneficial outcomes, compared to the mindfulness meditation. So those are good, and any form of self-care, any form of taking time for your own personal enjoyment is good. But delving into the deeper sources of stress, delving into the repressed emotions and making yourself aware of those, that's even more powerful.
And that's where professionals like yourself come in.
Absolutely, yes. And we're training people how to use these techniques. We've got on the website an online course that's based on the graduate school courses that I teach to doctoral candidate students. But we've removed the jargon from it so that even people who are not healthcare professionals can take that course. We've got, in addition to the book of mine that I wrote for the public, we've got a textbook called Psychophysiologic Disorders. And even though that's aimed at healthcare professionals, if you're a more, let's say, science-oriented reader,
Right.
we took the jargon out of that one too, so that anybody can read it.
Doctor, please stand by. We have to take our final break. Exonation, Dr. David Clarke, MD, is our special guest. Here's two websites, ppdassociation.org and endchronicpain.org. We'll be back on the other side of this short break as we wrap up this hour here in the X Zone with yours truly, Rob McConnell, from our broadcast center and studios in Crystal Beach, Ontario.
We're still worth one more try. I know we put a last one by just for the rain. I would have given you all of my heart, but there's someone who's torn it apart, and she's taken almost all that I've got. But if you want, I'll try to love again. Baby, I'll try to love again, but I
Dr. David Clarke, MD, is our special guest, Exonation. He's the author of, you ready for this? They Can't Find Anything Wrong. And two websites, ppdassociation.org and endchronicpain.org. As I said to you during the break, Doctor, thank you so much for coming on the show and for the work that you're doing and getting out this very important message. So from all our listeners to you, sir, thank you.
You're most welcome, and I greatly appreciate being on your show, Rob. Thank you.
Well, the door is always open for you, Doctor. Love to have you back in the future. But tell me, we talked about several ways. We talked about meditation. We talked about hypnosis. How important is the diet that a person, not regulates, but regiments themselves with when it comes to stress or even working against stress?
Yeah, well, I'm a big advocate of a healthy diet. I like to follow in my own life what's called the Mediterranean diet, a minimum of processed foods, lots of vegetables, not so much meat.
Right.
And that's going to be good for a healthy body, and anything that helps your body is going to help you cope with stress wherever it's coming from. On the other hand, the diet can be taken too far. A lot of people who have symptoms, particularly gastrointestinal symptoms, will, whenever those symptoms flare up, they'll blame whatever they just ate.
Right.
And more often than not, it's just a coincidence, that it's actually the stress that's causing their gastrointestinal symptoms to flare up and not the food that they just ate. If they're having a reaction 10 times out of 10 every time that they ingest a certain food, then I'd be willing to concede they probably have a sensitivity to that. But if they only have it occasionally, then much more likely is the fact that stress is causing their symptoms and not the food. But I've had some patients who keep eliminating things from their diet because they are blaming them for this symptom or the other, and they come into my office and they're down to white bread and rice and water, and there's really no need for that. When we identify the true cause of their symptoms, when we uncover the stresses that they're struggling with, and the symptoms start to improve, they're able to reintroduce all the foods that they used to avoid back into their diet, and it's a clear indication that they're making progress.
So what can we do as the public in order to help you get this message out there?
Well, anyone who's personally experienced this and experienced improvement with the resources that are out there, whether it's the books or there's an app called Curable. We're in the 21st century, so we've got apps for everything. But the Curable folks have gone to most of my most knowledgeable colleagues and taken all their best ideas and wrapped it into a really good user interface that's helped thousands and thousands of people at this point. So when people improve, whether it's from the books or the class, the online course, or the app, if they go to their physicians and say, look, these resources helped me. I followed up on these approaches to my chronic symptoms, and I experienced improvement. And if the doctor hears that from a patient or a couple of patients or 3 or 4 patients, they're going to start looking into it themselves. These patients are so frustrating for doctors that they actually contribute to burnout. In the UK, this population of patients is sometimes referred to as heart sink patients, because when the doctor sees the name of one of these people on their list for the day, their heart sinks. But if you know what to do, if you know what questions to ask and what to do with the answers, and it's not difficult to learn. We teach people in a couple of hours. There's one group not too far from you in the Albany, New York area.
Yeah.
They got 3 hours of training along these lines. Even less than there is in the online webinar course, and it just transformed their practice. They all of a sudden found they could diagnose people that previously had them beating their heads against the wall. And one of them took me aside at a conference and said, these concepts have put the joy back into my practice. It was so wonderful to hear that.
I would imagine it is, because the medical community was under stress before COVID.
Yes.
COVID just added it on, and even the time that a doctor takes with the seeing the patients now has drastically decreased. I think here in Ontario it's 4 minutes.
Yeah, it's difficult to assess a patient for these issues in 4 minutes, but you don't, even under those kind of high pressure circumstances, you can gather the information a little bit at a time. What stress is the person under at the moment? What kinds of stresses did they experience as a child? Are they suffering from a bodily manifestation of a mental health condition like depression or anxiety or post-traumatic stress? You can get that information from a patient over a couple of visits and build up a picture of what's going on. The key thing is just to be aware of just how ill you can get from these sources of stress. And once you take that into consideration, the outcomes that you get become dramatically better.
What you're talking about and the results of stress is truly eye-opening. Truly eye-opening. And I'm sitting here listening to you, and I'm seeing that stress may not show itself right away, but it's kind of when stress is diagnosed, it's like the body is at its breaking point, and it's like a pressure valve. Am I getting the right idea here?
Yeah, I mean, it's when the stress cannot be expressed in words, when people can't use their cognitive abilities to cope with it, because oftentimes they're not consciously aware of all the different places that the stress is coming from, then it tends to end up getting expressed via the body. My very first patient, the one that baffled 2 universities, she just wasn't consciously aware of the magnitude of stress that she had from her terrible childhood experience. But once we were able to help her see that and be able to talk about it and write about it, then those issues no longer had to manifest via her body.
I wonder how many people who go through divorces really don't know that the amount of stress that they're under or they were under, they carry into the next relationship. And you get stress on top of stress, and I'm sure that the ailments or going to the doctor must be a direct result of this as well.
Yeah, I mean, any source of stress can do it, and divorce is certainly a big one. As I mentioned, many of my patients who were made to feel like second-rate human beings when they were young, or who grew up in environments where they kind of took responsibility for older people in the family that had significant issues that they were coping with. They tend to choose partners for themselves, particularly early in their lives, who have a lot of needs, and who don't necessarily treat them very well, because that's what they grew up with. They grew up not being treated very well. They grew up with people that demanded a lot from them, even as children. So it's only natural they fall into those same kinds of relationships with their adult partners.
Unreal.
And it takes a long time to develop enough self-esteem and self-respect that you recognize you deserve something better in your life.
Doctor, the time has come where we must say so long, but before that, I've got a minute that I would like to let you just give a message to the X-Zone Nation tonight listening. What are your final thoughts, sir?
Well, we're here on a night when there's a full moon, and we're 11 days before Halloween, so it feels like we should be talking about all kinds of wild and strange things. But what we're actually talking about tonight is, at long last, in the last couple of years, got extremely rigorous science behind it. And it's time for the healthcare profession and for the public to recognize just how important this issue is, and to recognize that there's tremendous hope as well.
Doctor, I want to thank you so much for joining us tonight. Please, continued success. And from our listeners and from everyone here, thank you very much for all the great work that you're doing.
Thank you, Rob. It's been a pleasure.
Take care, Doctor, and I hope to have you back on in the future.
You betcha.
Take care of yourself, sir, and your family.
You too.
X-Zone Nation, our guest this hour has been Dr. David Clarke, MD. Here's two websites, ppaassociation.org and endchronicpain.org. It's so nice to see the medical community and a doctor like Dr. Clarke, putting the pieces of the jigsaw together, and that there is hope for people who suffer from stress and the pain that is associated with stress. And I think it says it best in the doctor's title of his book. They can't find anything wrong with me. That's because, in my opinion, it's stress. We'll be back on the other side of this commercial break with the news as we continue here in the X-Zone from our broadcast center and studios in Crystal Beach, Ontario. My name is Rob McConnell. Whatever you do, don't go away, because I'll be back.